Hello, everyone, and welcome to Medical Sauce, where we make medicine simple, memorable, and fun. I'm Dr. Momo. Today, we're discussing an important topic, the difference between left-sided and right-sided heart failure. They are both forms of heart failure, but the signs and symptoms can be quite different.
Thank you, Momo. I'm excited to break this one down because there's a very simple way to remember the difference.
Azula, let's start with left-sided heart failure. What exactly happens?
The left side of the heart receives oxygenated blood from the lungs and pumps it to the rest of the body. When the left ventricle cannot pump effectively, blood backs up behind the left side of the heart and into the lungs. That's why the major problem in left-sided heart failure is the lungs.
What signs and symptoms should we look out for?
The main features are respiratory. The patient may develop shortness of breath, difficulty breathing when lying flat, known as orthopnea, waking up at night with severe breathlessness called paroxysmal nocturnal dyspnea, cough, crackles on lung examination, pulmonary edema in severe cases. They may also experience fatigue and reduced exercise tolerance because the heart isn't pumping enough blood forward.
So when we hear left-sided heart failure, we should immediately think about the lungs?
Exactly. Left-sided failure is blood backs up into the lungs, causing breathing problems.
Now let's move to right-sided heart failure. What's the major difference?
The right side of the heart receives deoxygenated blood from the body and pumps it into the lungs. When the right side fails, blood backs up into the systemic venous circulation. So the major problem becomes the body.
What signs and symptoms should we expect?
Look for swelling of the feet and ankles, abdominal swelling from fluid accumulation called ascites, rapid weight gain from fluid retention, raised jugular venous pressure, enlarged liver, or hepatomegaly.
So instead of fluid backing up mainly into the lungs, it's backing up into the body?
Exactly. Right-sided failure is systemic venous congestion causing swelling and fluid accumulation.
Can a patient have both left and right-sided heart failure?
Absolutely, they can occur together. In fact, long-standing left-sided heart failure can eventually contribute to right-sided heart failure.
Interesting.
Here's the sequence. Left ventricle struggles to pump, pressure builds up in the lungs, pulmonary pressures increase. The right side has to pump against greater resistance. The right side may eventually become weakened. When both sides are affected, this can be referred to as biventricular heart failure. So one side can eventually put pressure on the other.
Azula, give our listeners one final memory trick.
Very simple. Left equals lungs, right equals rest of the body Left-sided heart failure, think lung congestion and breathing problems. Right-sided heart failure, think systemic congestion, swelling, and fluid retention.
Left equals lungs, right equals the rest of the body. That's easy to remember. Thank you, everyone, for listening to Medical Sauce. If this episode helped you, share it with your classmates, and we'll see you in the next episode.
Please answer the following question and we will give you a shout out in the next episode. Today's shout out goes to Osman Abdul Kadir. Congratulations and see you in the next episode. Bye for now.
Yes. Thanks for watching. Bye.